Wonderful. Thank you so much. Hi, everyone. Thanks for being here on what is today, the 22nd. Really rolling into the holidays here. So I truly appreciate you taking time to be with me today. And we're going to talk a little bit about feline idiopathic cystitis and some ways to address that. So first, there we go. First, I would like to thank Assisi Animal Health, as I always do, because these guys have been phenomenal partners in the industry, helping to keep all of us educated for free, which is no small feat. This has been quite the year, as we all know. But for Assisi to offer free continuing education to all of us has been phenomenal. So thank you to the entire Assisi Animal Health team. So let's start by talking about inappropriate elimination. And that really is part of FIC, right? So we know inappropriate elimination is why many of us as pet owners bring their pets, their cats, to the veterinary hospital. But unfortunately, it's also a very common reason why we as pet owners also relinquish cats to shelters. It becomes really too much for some owners to handle, and sometimes it takes a while for the management to truly kick in, and often those two things combined just cause some pet owners to give their cats over to a shelter. So we're going to look at that and try to talk about some different management options today. So if we look at FIC, what we first have to do is step back a little bit further and look at feline lower urinary tract diseases. And we know, as we just talked about, that feline lower urinary tract, hold on one second. I am so sorry. I hate it when the fire alarms go off. So again,
no.
I am so sorry.
We're good as long as you're safe.
Yeah, everything is here is okay. So I apologize for that. So as we just were talking about, we know that feline lower urinary tract disease has a huge impact on the animal and human bond, that pet and family bond, right? Because all of us on the call today consider our pets as family members. And you can see that here. So we know that FIC also has a big impact on the human animal bond. So what are some of the causes of feline lower urinary tract disease? Well, one of the biggest causes is FIC. And if we say feline idiopathic cystitis, what does that mean? Well, it means we're not really sure what's causing it. So what are the causes? 60%, we really don't know. 20% are uroliths. So think of struvite crystals and calcium oxalate crystals. And then also urinary plugs. So 15% are urinary plugs, and those are most often made up of struvite. which is a type of crystal. You may have heard these words when talking to your veterinary healthcare team. And then 5% is the always present miscellaneous, right? So it's typically when it falls under miscellaneous, it could be cancer, it could be the way the anatomy is structured, causing issues. So, but what we're going to focus on today is the green, is the feline idiopathic cystitis. So what typically I like to ask, what if you have had a pet with feline lower urinary tract disorder, what has your veterinary hospital recommended? Because there are a number of management options. Obviously, we're not going to talk about all of these today. And some are more, some help more than others. Oftentimes, what I like to do is look at the research that is available. And the research that's available is mainly aimed at environmental, or is mainly supported. So that would be environmental enrichment, increased water intake, or even canned food, and then therapeutic urinary foods. But there's also one more that we're going to talk about, obviously. But you heard that I'm into nutrition. And if you've been on any of my other webinars, then you'll know that I like to look at nutrition first, and then we're going to look at a couple of other things. But it's important to know that with feline idiopathic cystitis, no matter what we do or what we don't do, that the acute episodes, so the episodes where they're extremely painful and they are straining and sometimes going other than in the box, those episodes usually last from 3 to 7 days. Now, is it still painful for the pet? Absolutely. And so we need to look at some of the goals. What do we want to accomplish? So what do we want to accomplish, right? What is the goal of therapy? To decrease the number of painful days. Okay, I think you would agree with that. We don't want our cats, our family members, to be painful. So we're going to take a look at this. First, we're going to look at nutritionally. Can nutrition help decrease pain and inflammation and help shorten those, acute episodes? Absolutely, they can. And there is research to back that. But some of the key nutritional factors when we talk about fluted, so feline lower urinary tract disease, so when we talk about that as a whole, and then I'm also going to get into some specific nutrients a little bit later to help specifically with FIC. So what we want to do for our lower urinary tract disease cats is have controlled levels of certain minerals. So magnesium, calcium, phosphorus, and oxalate. Remember what I said when we're talking about uroliths and crystals. Magnesium, calcium, phosphorus, and oxalate, those are all building blocks for struvite and for calcium oxalate crystals. So, overall, we want a lower amount or controlled levels of those because, as I said, they are building blocks. Added citrate. So again, all of these things that I'm going to talk about are really trying to inhibit crystals and urolith growth. And then we want to decrease oxalate formation and excretion because calcium oxalates are seen more often in older cats, but still younger cats can get them. And so to do that, we're going to enhance vitamin B6. Okay, so we're going to add a little bit more into the formula. So the other thing that is extremely important is having antioxidants, vitamin E, vitamin C, beta carotene. Okay, because they're going to help counteract that oxidative stress and get the energy within the cells really working better and thus improved. And the antioxidants are also going to help generate an environment. So think of the urinary bladder. I know that's what you want to think about a couple of days before the holidays, but the urinary bladder, we don't want a favorable, right, environment for crystals. So by adding antioxidants and specific ones, we're going to make sure that that's not a favorable environment for crystal development. And then you've probably heard me talk about omega-3 fatty acids before. Feline lower urinary tract disease and FIC in particular are have a huge inflammation component. So we want to decrease that inflammation, and omega-3 fatty acids are going to help break that inflammatory cycle and decrease the inflammation. Now, if we're talking about other things to help reduce stress, especially with FIC, because a big part of feline idiopathic cystitis is stress. So what causes it? Not 100% sure, but what exacerbates it? Stress is a definite component to making FIC worse. So we want to look then at environmental enrichment, right? We keep our cats inside to keep them safe. But when we do that, we need to think about modifying, if you will, the environment for them. So, I mean, it's as simple as you can see here, a scratching post, a vertical scratching post, where the cats can kind of stretch out and scratch their claws. What we want to do is provide opportunities for those enjoyable activities, or those activities that are kind of innate in them. So scratching posts, we want interactive toys. Places to hide. Cats like to hide. They like to obviously rest. And so what we call kitty condos are great for environmental enrichment and to decrease the stress that comes along with, well, one, with cats, and two, with having them stay indoors. And food and water dishes, where they're located, are we cleaning them? You know, what I mean by where they're located is, if we have a litter box or their food and water and they're in the laundry room, and the cat goes in maybe to urinate and the washer goes onto the spin cycle and makes that noise, that is stressful for cats. If we have their food and water dishes next to the dog food and water dishes, that can be considered stressful for cats. And then, are we cleaning them, right? Are we making sure that, you know, we're not just putting canned food in or even dry food in and never washing their bowls or never washing their water bowl? So things to think about, because these, although they may seem small, these things do add up and definitely promote stress, which then helps to promote feline idiopathic cystitis. So here are some of the kitty condos that I was talking about, and the interactive toys. If you see this one in the middle, I mean, there's a whole bunch of places for those cats to play and to hide. The same in the lower left. And then interactive toys, mind stimulation toys in the lower right, right? They're kind of hunting. We're trying to replicate the outdoors inside. And then litter box recommendations. Now, I see a lot of this type of litter box for sale. But this one, there are some cats that are going to love it, right? But there are also more cats that aren't, because if you have more than one cat or cat and a dog, then the other cats could be like hanging out right here waiting for them to come out and pounce on them. And that becomes a stress-inducing environment. So There's also a specific number of litter boxes that you should have with, depending on, I should say, the number of cats you have. So basically, it's 1 litter box per cat plus 1. So if I have 3 cats, I should have 4 litter boxes. So it's basically, the guidelines are 1 plus 1, okay? And veterinary behaviorists have done a lot of research on this because of the fact that urinary problems lead to behavior problems that then lead to cats being relinquished to shelters. So the characteristics of a litter box that pet owners have, or that veterinary behaviorists have come up with, it should be 1.5 times the length of the cat. Okay, so it should be big enough for that cat to fit in it. We really should start to think about having lower sides for older cats, because older cats have, you know, a number of concurrent diseases, osteoarthritis being one of them. And if they can't get into the litter box, then obviously they can't use the litter box. And also, as we just talked about, it should be located where the cat can escape. Okay, so they're not being cornered in their litter box. And it has been found, veterinary behaviorists again have found, that most cats prefer litter that is clumping and unscented. It's truly us as pet owners that we want the scent because we think it helps mask, you know, the litter odor. But actually, it's much better for the cat if it's unscented. And then, you know, litter box maintenance. We do have to, you know, scoop it every day, wash it at least once a week, and truly maintain the cleanliness to help cut down on litter box issues or the development or the aversion to using the litter box. And so this isn't anything to get, you know, that you have to memorize. This is just showing you that, again, I mentioned research, and this research of environmental enrichment or environmental modification actually did show reductions in lower urinary tract signs, fearfulness, and nervousness. There's a great website for veterinary healthcare teams and also for us as pet owners. And it's the Indoor Pet, it's called Indoor Pet Initiative. So you could either put in Indoor Pet Initiative and it will come up, or indoorpet.osu.edu, which is the Ohio State. Dr. Tony Buffington, he was at Ohio State before he retired, and he is a big proponent of environmental enrichment and developed this website. Great resources on here, so I highly recommend this website. So fewer painful episodes means less straining in the litter box, right? Less hanging out in the litter box, and more time for loving, cuddling, and attention that cats deserve, and they know they deserve it, right? So what does make a cat fearful? And does that fear initiate stress, right? This cat on the left-hand side, we know that cat's stressed. Do we know if the cat on the right is stressed? Well, maybe not necessarily, but that cat does appear to be hiding. So we have to think about what is stressful for cats. And so what are some of the risk factors that are consistent with stress? Well, we talked about nervousness and fearful. Cats don't like change, truly. So they hide from visitors, and they especially hate when you either move your house completely, or if you're redecorating inside and you move, you know, the couch, that is extremely stressful for cats. So those are some things to keep in mind. So what are some of the common anxiety triggers? We just talked about them. People, sounds, loud sounds, right? Cats do not like loud sounds. We always think of 4th of July or fireworks, I should say, thunderstorms as being stressors for dogs, which they are, but they're also stressors for cats because cats do not like loud sounds. And other animals. So think about multi-cat households and or households with dogs in them. Doesn't mean they don't get along, but sometimes that anxiety can be triggered by other animals within the house. So if we have an environmental stressor for cats, which we just talked about, right? So there's some stress to the cat, which is going to activate that stress response system, which will then enhance that sympathetic activity, which increases outflow to the urinary bladder. And you don't have to get, down and deep into this. I'm just going to show you how stress plays a role in the cat's brain and their bladder. Okay. And so then we know that there's neurogenic inflammation, which is inflammation due to psychological stressors. And then the nervous system, right, transfers that pain back to the brain. So we see how the brain and the bladder play a role, but they're connected when it comes to environmental stressors. So I want you to remember that stress truly does affect the bladder and the brain. So with chronic stress, we then have an abnormal stress response, bladder inflammation, and chronic pain. Remember I said that FIC is both painful and an inflammatory condition. And so we end up with, a cat that just isn't feeling well, isn't doing well, and is in pain. And that's not what we want. So what we want to do is a multimodal approach. We want to manage that stress, typically through behavioral therapy, also through nutritional management. So we have nutritional management for FLUTD as a whole, which is lower urinary tract disease as a whole, but also certain nutrients, which we're going to talk about next, that help to manage stress in cats. And then pain management. And all of this is connected. And again, it's a multimodal approach to managing that stress. This is the picture that we want, right? We want a relaxed cat interacting with their family. So, excuse me, stay with me here, because what has been found is we have a milk protein. Okay, so I don't want you to think that you're going to have to give your cat skim milk or anything like that. But from skim milk, we get a milk protein that has been basically synthesized, and it ends up being hydrolyzed casein. So it's hydrolyzed, so it's broken down. So the cat's body isn't going to recognize it as a milk protein. That goes off into a whole nother talk that we don't have to worry about right now. But what I want you to remember is that hydrolyzed casein, so once we synthesize that and we get hydrolyzed casein, which is also known as alpha-casozepine, that affects mood and anxiety. It's think of it as serotonin. Okay, it's one of those good amino acids for the brain. And so this comes from, think about you often hear that warm milk before bed helps people to sleep, right? It's an old wives' tale or whatever you want to call it. Well, there is some truth to that, because if we can synthesize that alpha casozepine, that milk protein from milk, and give it to mammals, we will see an alteration, a positive alteration in mood and anxiety. So this is just to show you that alpha casozepine decreased anxiety in a number of different species. You don't have to know this or memorize this. This is just to show you that not just in cats, but in a number of different species. Most importantly, though, for FIC, we had a study that was done that showed that alpha casozepine decreased fearfulness and increased contact with people. So remember, we talked about those anxiety triggers, those stressors, right? Fearfulness, nervousness, they are afraid of people. Well, this one nutrient was able to decrease that fearfulness and increase contact with people. So this is why I always love to talk about nutrition, is because, again, one nutrient has that effect. Now let's look at another amino acid, tryptophan. And again, okay, we're talking about synthesizing the tryptophan down to actually serotonin. And so increased dietary tryptophan has been associated with improved coping ability and mood in stress vulnerable people, decreased territorial aggression in dogs, decreased owner-reported anxiety in dogs. Again, I'm trying to show you that this is this serotonin, this mood relaxing nutrient, has been seen to be effective in other species. So what about in cats? Well, again, another study looked at it specifically in cats, and it was found that alpha casozepine, when given to cats or added into their food, we saw less anxiety and stress-related behaviors. So again, we have the nutrition and what I talked about earlier, and now we have two more nutrients that help decrease the anxiety, which will help decrease that stress response in FIC. I hope that makes sense to you guys. So, of course, we have another phenomenal tool to help in our multimodal approach. We want to manage pain. We want to manage inflammation. Those are the two big things that we've been talking about. And we talked about environmental enrichment. We talked about nutrition. And we can also talk about, obviously, pain medications, but the Assisi loop. And you see that here. Okay. And so it helps with cystitis. It helps to decrease that inflammation, which is going to help decrease pain. So we know that the Assisi loop is pulsed electromagnetic field therapy, right? You see it here. That's a great visual on the black and white cat at the top. And this is going to deliver that signal that's tuned specifically to minimize pain and accelerate healing. And it's going to stimulate the body's own natural anti-inflammatory process while speeding the healing of those urinary tract tissues. So again, this multimodal approach is pretty phenomenal. We know that what are the benefits of this therapy? As I said, it reduces pain, reduces swelling, so that inflammation. It's going to help accelerate healing. It's compatible with treatments for with other treatments for preventing inflammation. And many veterinarians are going to put their FIC or their lower urinary tract disease cats on pain medication, which is an extremely painful condition. But by using the Assisi loop, we can also reduce the amount of that pain medication that's needed. And, we know because we've used the Assisi loop that there's, no dangerous side effects. So we know that feline lower urinary tract disease is a pretty serious disease. It's a common disease, and it's a disease that unfortunately leads to relinquishment and breaks that human-animal bond. We don't want that to continue happening. What we want is fewer painful days during an FIC episode. And we can get that through this multimodal approach. So we have stress management, right? And again, we have behavioral therapy, we have nutritional management with specific nutrients to help reduce anxiety or stress, and pain management in the form of the Assisi loop. So talk about a great multimodal approach. We've got that. You have that. So I know we are at time. So again, apologies for the fire alarm, but thank you so much for your time.